Swastiastu. Good morning, doctors. We are from SGD B5. In this video, we will present our student projects. Here are the list of our SGD. The next presentation will be continued by my partner.
Thank you, Doctor and the moderator. Firstly, let me introduce myself. My name is Komang Chandra with last digit number is 091. So in this session, I will explain about Chapter 1 Introduction. So what is cyclothymia? Cyclothymia, also known as cyclothymic disorders, is a significant mood disorder. While not as well known as bipolar disorder, cyclothymia mood fluctuations are impactful. So understanding cyclothymia is crucial for mental health awareness and education. It affects about 0.4% to 1% of general population. So cyclothymia is characteristic by cycling between mild depression and hypomania. Then the untreated cyclothymia can harm an individual's quality of life and mental health. That's all for me. Thank you.
All right, first of all, thank you for the opportunity. Let me introduce myself. My name is Justin, with the last three digits of my student number being 106. And today I'll be explaining the problem formulation and then the objective and then the benefit of our paper. So, as for the problem formulation, first is what is cyclothymia? Second is what are the signs and symptoms of cyclothymia? Third is what are the causes of cyclothymia? And last is what is the treatment for cyclothymia? As for the objective of our paper is to help readers recognize and gain a wider understanding of cyclothymia as a disease that affects people's daily lives in a negative way. As for the benefit of our paper is this paper was written in the hopes that better understanding cyclothymia can help medical professionals recognize, treat, and hopefully cure patients with cyclothymia and provide knowledge for further research in the future, especially pertaining to cyclothymia. That'll be all from me. Thank you.
Cyclothymia is an affective personality disorder marked by episodes of hypomania and depression that do not fully match the diagnostic criteria for bipolar disorder or major depressive disorder. It is also defined by a persistent inability to regulate one's mood.
Hello, my name is Ananda Aulia with three last digits of my student number is 015. Now I'll present you about the prevalence and epidemiology of cyclothymia. Cyclothymic disorder has around 0.4% to 1% lifetime prevalence. In the general population, cyclothymic disorder appears to affect males and females equally. However, in the clinical settings, it's possible that females with cyclothymic disorder may be more inclined to seek treatment compared to males. Next slide.
Hello, my name is Dinaria Sakura Kirani with the last three digits of my student number is 055, and I will present to you the etiology and risk factor. The first is neurological factor. Neurotransmitters such as dopamine, serotonin, and noradrenaline levels could be impacted by a variety of physical changes. Brain damage may be related to changes in neuroplasticity, such as changes in neurotrophic signaling, causing worsening mood episode and ultimately reduced cognitive and functional abilities on people with cyclothymia. Gray matter volume in the left medial frontal gyrus and activation or deactivations of the left lingual gyrus during memory or judgment tasks linked to cyclothymic temperament. Cyclothymic temperament increased neural variability in the sensory motor network. That's all from me. The presentation will be continued by my partner. Thank you.
I am Helena Angeline Darvis with the last three digit number 141. Now I will further discuss the etiology and risk factors caused by psychosocial factors. As mentioned before, cyclothymia has a close relationship to bipolar disorder, in which psychological and social factors are involved in its occurrence. Similar to bipolar disorder, cyclothymia could occur due to negative life experiences, for instance, prolonged stress and traumatic life events. These life events can be classified into several types based on the moods resulting from it. Major life setbacks may trigger mania or depression, as well as relapses of mood swings. Problems found in interpersonal relationships or career failure are some examples. Its impact will depend on how big the load or burden quantity felt by the patient.
Good afternoon, my name is Philbert Purbowo and last digits of my name is 148. So the etiology of cyclothymia is currently still unknown, and it is hypothesized to be caused by a combination of genetics, epigenetics, neurochemical, and environmental factors. The studies aim to locate genes related to them, and this was first achieved in 1987, where it was identified connected with DNA markers on the short arm of chromosome 11. Now, molecular testing, molecular genetic studies, and polymorphism frequency testing identified the following genes: BDNF genes, tyrosine hydroxylase genes, tyrosine kinase FYN genes, beta synthetasion genes, and MMP9 gene. Now, studies following that in 2019, the most recent study, it was found 30 genes connected with bipolar disorder, 10 of which were found in the previous studies. Some of those genes include CAC and NA1C gene, ANK3 gene, the ANK1 gene, NCAN gene, ODZ4 gene, FADS2 gene. And the newly identified ones worth mentioning include SHANK2 gene, SNZNF592 gene, GRIN2A gene. That's all from me. Thank you.
My name is Putu Ayudhea Anjanika with 3 last digit NIM number 164. So in the clinical manifestations of cyclothymia, there's mood changes. Increased mood reactivity is manifested as a unique sensitivity to various environmental stimuli. Individuals with cyclothymia respond to positive circumstance by swiftly experiencing intense joy, enthusiasm, and increased activity. In some instances, they may momentarily display excessive euphoria and impulsive behavior. And for the negative circumstances, whether real or perceived, with disproportionately intense feelings of sadness, profound fatigue, distress, desperation, and at times even contemplate self-harm or suicide. When coupled with irritability and impulsivity, these emotions can lead to uncontrolled outbursts.
My name is Putu Anandita Wirashayani with my last 3 digit of ID number being 185. So depression is a mood disorder characterized by the occurrence of prolonged sense of sadness and loss of interest. According to DSM-5, there are 5 types of depressive disorders, which includes major depressive disorder, persistent depressive disorder or dysthymia, premenstrual dysphoric disorder, disruptive mood dysregulation disorder, and depressive disorder resulting from another medical condition. All of these depressive disorders include a sense of sorrow, emptiness, or irritability with accompanying physical and cognitive alterations that have a major impact on the person's ability to function. The depressive symptoms experienced by a person with cyclothymia, however, do not fully satisfy the criteria for bipolar or major depressive disorder.
Hello again, my name is Dinaria with the last 3 digits of my student number is 055. The third clinical manifestations is hypomania. Mania is the stage when racing thoughts, excessive energy, and wired feeling takes over. Hypomania is a less extreme mania. Hypomanic episodes do not cause significant distress or impair one's work, family, or social life, but can evolve into mania. The symptoms of hypomania, such as having a lot of energy, feeling euphoric or wired, having irrational thoughts, speaking quickly, being challenged to take more risks, requiring less sleep than normal to feel refreshed, being more easily distracted than usual, and having strong sensations like scent and touch. That's all from me. The presentations will be continued by my partner.
Hello, my name is Ananda Aulia with 3 last digits of my student ID number is 015. Now I'll present you about the diagnosis of cyclothymia based on PPDGG3 and the DSM-5. The diagnosis based on PPDGG3, the diagnosis guidelines state that the main characteristic of cyclothymia is the presence of persistent mood instability, including numerous episodes of mild depression and mild elation, which do not reach the severity or duration required to meet the criteria for bipolar affective disorder F31 or recurrent depressive disorder F33. This also means that each episode of mood fluctuation doesn't meet the criteria for other categories such as manic episodes F30 or depressive episodes F32. Cyclothymia is classified within the group of affective personality disorder such as cycloid personality or cyclothymic personality. Next slide. The diagnosis of cyclothymia based on the DSM-5. Criterion A. Cyclothymic disorder involves persistent mood swings with recurring periods of hypomanic symptoms and separate depressive symptoms. These mood swings shouldn't be explained by other conditions. Criterion B. These symptoms must be present for at least 2 years with symptoms-free breaks not exceeding 2 months. Criterion C. To receive a diagnosis, the person mustn't have experienced major depressive, manic, or hypomanic episodes. Criterion D. The diagnosis is ruled out if other conditions explain the mood swings, and they shouldn't be due to symptoms or medical condition which is included in Criterion E. And the last one is Criterion F. Even if some function well during hypomanic periods, there must be noticeable distress or impairment in daily life due to these mood changes over time. Next slide.
The treatment for cyclothymia involves addressing risk factor and early symptoms recognition with interventions such as psychoeducation, medication therapy, and counseling focusing on emotional instability. While there are no FDA-approved medication for cyclothymia, mood stabilizers like valproate and lamotrigine are commonly prescribed depending on the dominant symptoms. Lithium is an option for those with intense mood swings, and combination therapy with lithium or lamotrigine may be beneficial. A typical antipsychotic can be used alone or with mood stabilizer. Caution is advised when considering an antidepressant as they may potentially worsen symptoms.
Thank you for the time. My name is Nathanael Farrel with last student number digit 077. I'm going to talk about non-pharmacological treatment for cyclothymia. An effective treatment plan for cyclothymia involves personalized psychoeducation and, if necessary, psychotherapy. Given the unpredictable nature of cyclothymia, ongoing psychoeducation should be integrated into follow-up appointments. It's crucial to recognize that psychoeducational approaches tailored for bipolar stage 1 may not fully address the unique psychological, behavioral, and interpersonal aspects of cyclothymia, potentially causing patients with cyclothymia to feel unsupported or misunderstood. Next will be explained by my colleague.
My name is Putu Devi with last digit of student number is 159. Cyclothymia is an affective personality disorder marked by episodes of hypomania and depression that do not fully match the diagnostic criteria for bipolar disorder or major depressive disorder. Cyclothymic temperaments is associated with opposite change in the sensory-motor network variability and is related to gray matter volume in left medial frontal gyrus. Cyclothymia could occur due to negative life experiences. The etiology and genetic factors of bipolar disorders are currently still unknown. However, it is hypothesized to be caused by a combination of genetic, epigenetic, neurochemical, and environmental factors. There are 3 clinical manifestations of cyclothymia, which are mood change, one of the primary characteristics of cyclothymia. Then this depression, which is a mood disorder characterized by the occurrence of prolonged sense of sadness and loss of interest. And lastly, hypomania. Based on PPDJ3, the diagnostic guidelines states that the main characteristic of cyclothymia is the presence of persistent mood instability, which do not reach the severity or duration required to meet the criteria of bipolar affective disorder or recurrent depressive disorder. Meanwhile, based on this M5, cyclothymic disorder is characterized in 6 criteria. The pharmacological treatment of cyclothymia involves addressing risk factors, early symptom recognition, and the implementation of suitable intervention. This intervention should include psychoeducation, medical or medicational therapy, and counseling.
This is our student project presentation. Thank you.